Hey T. Hey T. You still doing it? Hey T. Class been over about 20 minutes now. What you still doing it?
It's messed up, man.
What's up?
One of my buddies was, I don't know, in the gym, he just fell out, started shaking, foaming at the mouth.
Dang.
I don't know what was going on.
What happened to him?
I don't know.
Dang. So you think we'll cover that?
I don't know. He just fell out.
Looking kind of thin there. You dieted? Hello, I'm a doctor, and I'm here to speak about epilepsy. Epilepsy is a medical condition that affects the central nervous system of the brain and produces unprovoked seizures. A seizure happens when a brief, strong surge of electrical activity affects part or all of the brain. When a person has 2 or more seizures, they are considered to have epilepsy. A simple partial seizure remains restricted to a limited part of the brain. The patient will experience abnormal sensations or repetitive automatic behaviors. However, their consciousness remains intact. Complex partial seizures affect both sides of the brain, but to a limited degree. Symptoms are clouding of consciousness, staring spells, lip smacking, and amnesia. An absence seizure is when the patient has a brief lapse of consciousness. Typically, the patient will interrupt the behavior, only to immediately resume the behavior, such as talking or eating. The tonic phase of the seizure is when the patient stiffens, mouth clenched tight or wide open with eyes wide open. The clonic phase of the seizure is as the seizure ends, the patient begins to have rhythmic jerking over the arms, legs, and face. Myoclonic seizures look like a brief electrical discharge has gone through the patient's body. The arms may come up, the head may drop. This kind of seizure typically lasts a second with almost an immediate return to full consciousness. Atonic seizures are events where there is an abrupt loss of muscle tone, with the patient falling to the floor with no attempt to catch themselves. A young person dealing with epilepsy tends to deal with a lot more emotional issues, like a feeling of inadequacy, sensitive to praise and recognition. Feelings are hurt easily, a low self-esteem, and finally, depression and suicide. A few social characteristics would be peer pressure, a potential risk of substance abuse, and finally, acceptance.
The most effective treatment has been seizure-preventing medications called anti-epileptic drugs. There is a special diet called the ketogenic diet, and it forces the patient's body to burn fat around the clock by keeping calories low and making fat products the primary food that the patient is getting. Surgery may be an option if all other treatments are not effective. Surgeons will remove abnormal tissue in the brain. Another surgery option is the vagal nerve stimulator, where surgeons will insert a device in the patient's chest and equip the patient with a bracelet. And when the patient is having a seizure, the bracelet is waved in front of the chest to trigger the stimulator to send a signal to the brain to help control the seizures. Teaching strategies. From my experience, is really just being prepared for them the best that you can. For instance, in the classroom that I was observing in, a child was wearing a bicycle helmet, and that was to protect her head if she was to have a seizure. These seizures can happen at any moment, and there's not much a person can do but make sure that the child or patient is in a safe setting and let the seizure take its course.
You digesting all that? Now that wraps up our presentation on epilepsy. And now you know. And knowing is half the battle. Thank you for joining me.